Today we will talk about repurposed antiparasitics in oncology, promise, evidence, and caution. Welcome to part 1 of this series, and keep tuned for next week's part 2. Cancer remains one of the greatest medical challenges of our age. Despite advances in surgery, chemotherapy, immunotherapy, and targeted drugs, many cancers, especially metastatic disease, remain incurable. As researchers push into every possible strategy, one exciting frontier is drug repurposing, using medications already approved for other purposes and investigating whether they can attack cancer cells.
Among these, two antiparasitic drugs, ivermectin and fenbendazole, have drawn attention in both academic literature and popular media. In some online communities, they are passionately promoted as miracle cures for even late-stage cancers. But what does rigorous science actually show?
In this program, we explore what the published laboratory and animal studies say, proposed mechanisms of action at the molecular level, reported human case reports or testimonials, key criticisms, uncertainties, and safety concerns. What steps remain before any human use can be justified? Making sure to offer in-depth understanding so an informed decision can be made by everyone. No bias, just facts. Let's begin.
So, a bit of history. Ivermectin is a macrocyclic lactone widely used in humans for parasitic diseases like onchocerciasis, strongyloidiasis, and animals. Fenbendazole is a benzimidazole anthelmintic used in veterinary medicine to treat worms in livestock and pets. Because both have relatively well-known pharmacology, safety in animals, and to some extent humans for ivermectin, and are inexpensive, they have become targets for repurposing attempts. The hypothesis: maybe these drugs can stress cancer cells or exploit vulnerabilities that parasites and cancer share. For example, cytoskeleton, microtubule function, metabolic reprogramming.
But from the start, this is a high-risk hypothesis. Many drugs that kill parasites do not kill human cancer cells without toxicity. Thus, rigorous evidence is essential. Let us dive into ivermectin and cancer and what the literature shows. We begin by reviewing a key recent study. Ivermectin inhibits tumor metastasis by regulating the Wnt/beta-catenin/integrin beta-1/FAC signaling pathway by Zhang et al., 2022. The authors used colorectal cancer, HCT8, HCT116, and breast cancer, MCF7, MDAMB231 cell lines. In vitro assays, ivermectin, IVM, significantly inhibited cell migration in wound healing and transwell assays. They also tested a xenograft metastasis model, cells injected into mice to form metastatic nodules, then treated with ivermectin at 1, 2, 3 milligrams per kilogram intraperitoneally daily for 37 days. The treated mice exhibited fewer metastases in lung, muscle, and so on. In a separate subcutaneous tumor growth experiment, HCT8, mice treated with 2 to 3 milligrams per kilogram IVM showed slower tumor growth versus controls.
So let's see some mechanistic insights. Ivermectin suppressed expression of migration-related proteins, for example, integrin beta-1, focal adhesion kinase, FAK. It inhibited WNT/beta-catenin signaling, which is known to drive epithelial to mesenchymal transition, EMT, and metastasis. Downstream cascades such as the integrin beta-1 to FAK to cytoskeletal reorganization axis were dampened. Immunofluorescence and Western blotting confirmed reductions in beta-catenin levels, increases in epithelial markers, E-cadherin, and decreases in mesenchymal markers and matrix metalloproteinase 9, MMP9. In sum, this study suggests that IVM may exert anti-metastatic effects via modulation of Wnt/beta-catenin and integrin/FAK pathways.
Other emerging reports, for example, Rujimong Khan et al. 2025, explore ivermectin's inhibition of epithelial mesenchymal transition, EMT, in breast cancer models. Reviews of ivermectin's broader pharmacologic effects note immunomodulatory, anti-inflammatory, and modulation of transporters, for example, P-glycoprotein, at higher doses. However, no robust clinical trials in humans with cancer currently validate IVM's anti-cancer efficacy at safe doses. Thus, ivermectin shows promising signals, especially in migration and metastasis suppression in preclinical studies. But it does not yet prove it can reverse advanced or metastatic cancer in humans.
Now, let's talk about fenbendazole and cancer. This drug has perhaps drawn more attention in internet lore than ivermectin, mainly because a good number of patient reports have circulated widely. But how robust is the scientific data? A 2012 review, Fenbendazole as a Potential Anti-Cancer Drug, noted that lab work with benzimidazoles had some possible effects, but the authors concluded that these studies provided no evidence that fenbendazole would have value in cancer therapy in vivo, while recommending further study. One reason: fenbendazole has poor absorption and tissue penetration when given orally, making systemic exposure challenging.
Okay, we continue in part 2. Stay tuned.